Two Milwaukee alders will meet today to discuss a chance to accept funding from the state's Department of Health Services. It would allow the city to ramp up community testing programs and other COVID-19 related efforts.
Now, Ryan Jenkins, he's live in the newsroom this morning with more on the statewide pilot funding program. Ryan.
Hey, good morning. The city's Public Safety and Health Committee is going to meet at 9 o'clock this morning to talk about this funding. In total, the city may be able to accept nearly $4 million, money that would assist with the cost of testing efforts and other COVID-19 response programs like contact tracing. Now, documents show that the funds would be used to support testing in community-based settings, outbreak-based settings, and high-risk congregate settings. Without the funding, the documents say the ability of the health department to provide the services would be diminished. The conversation comes as Milwaukee County shares this week's COVID-19 numbers. Data shows there were 466 confirmed cases in Milwaukee County over the past week. That includes 86 hospitalizations and 12 deaths. 304 of those cases were in the city of Milwaukee. And new numbers also show there were 78 confirmed cases among children in Milwaukee County over the past week. Now, the number of cases in Milwaukee and the surrounding area have dropped over the past week, and that's on trend with the numbers we're seeing statewide right now. There are more than 9,800 active cases in the state right now. That number dropping below 10,000 for the first time since September. Back to you.
Well, the state is launching a new tool to simplify sign up for a coronavirus vaccine. A few local health departments will be the first to test it out online. It's a registry that opens next week in limited fashion. That will include Wauwatosa, Central Racine County, and Waukesha County. State working with Microsoft on the system. It will be available to local and tribal health departments across Wisconsin. Registry will screen for eligibility, guide people in making appointments, and connect information with vaccinators.
That will help to streamline that process, do more of the behind the scenes work for us, so we're not going in and manually doing all of those things. And then easier for the public too, so they don't have multiple different links or resources.
If there are no available appointments or people are not yet eligible, they'll be added to a wait list. The registry is set to officially launch March 1st.